Hello everyone, and welcome to this audio podcast. This audio podcast as part of a Proxyl interlude or intermission. This audio podcast as part of a Cataclysm Chiasma, and this audio podcast as part of as part of a Storm Robotics production. In this interlude, a little bit around HSP, around Henoch-Schönlein Purpura. Henoch-Schönlein Purpura. The pathogenesis of HSP remains unknown. However, it is generally considered to be an immune immune complex mediated disease characterized by the presence of polymeric IgA1 containing immune complexes predominantly in dermal, gastrointestinal, and glomerular capillaries. The pathogenesis around the granular aspects of IgA and C3 IgA and C3 deposits in the mesangium are indistinguishable from those seen in IgA nephropathy. Similar immunohistological findings have also been observed in the kidneys of patients with liver cirrhosis, dermatitis, hepatic form is the similar immunohistological findings have also been observed in kidneys of patients with liver cirrhosis, dermatitis, sort of celiac disease, and chronic inflammatory diseases of the lung. Where light microscopy is concerned, renal morphology in HSP cannot be distinguished definitively from that in IgA nephropathy, as the glomerular lesions are similar, and vasculitis is virtually never observed within the kidney. With the use of more proliferative lesions, there may be more intense staining with segmental IgA in capillary walls. Fibrinogen can be seen in the urinary space where crescents are present. Usually, using electron microscopy, there are variable visceral epithelial cell foot processes and capillary basement membrane thinning and thickening and lamination depending on the degree of glomerular injury. Prospective biomedical and laboratory practices should help tailor the clinical decision making in the care of young people with HSP. More case and longitudinal studies would be helpful to understand where the patients would benefit from different sort of care plan options, and prognosis is excellent in children or young people. In around 50% have spontaneous remission, but poorer in sort of adults, or poorer in adults or with nephrotic syndrome, with nephrotic syndrome, which can be difficult. Where HSP disease progression, HSP disease progression can be difficult to sort of predict. That draws this audio podcast to a close. This audio podcast has been part of a Proxyl intermission or Proxyl interlude. This has been an audio podcast as part of a Cataclysm Chiasma, and this audio podcast has been part of a Storm Robotics production. Hello everyone, and welcome to this audio podcast. This audio podcast as part of the Proxyl intermission, or the Proxyl interlude. This is an audio podcast as part of a Cataclysm Chiasma. This is an audio podcast as part of an interlude. An interlude as part of this in around this and around in around a another Storm Logistics production. In this audio podcast, there will be a an overview in around some abstracted works for WNC 2023, and where the abstracted works is around the importance of reduced nephrotoxic immunosuppression in pediatric renal recipients, and where this works is a review, and the original works around this was developed in 2000, originally in 2003. And so pediatric nephrology is established as an advanced clinical practice specialty in the world of clinical medicine. And though there is much research covered in this specialism, nephrologists have concern, or have had concern, over the medication prescribed and administered in pediatrics, since they have varying toxicological effects. The aims or objectives of this works was to establish whether renal allografts in pediatric renal recipients can have a prognosis of 10 to 20 years post-transplantation with the aid of immunosuppression with reduced nephrotoxicity. In around the design aspects, the design parts of this works, interrogating retrospective pediatric nephrology literature for this works was one of the best approaches to identify advances in immunosuppression therapeutics. This works sought to also include obtaining experimental data surrounding novel therapeutics, including effects of immunobiology, major histocompatibility complex, or MHC, human leukocyte antigen presenting cells, immunohematology, and immunogenetics post-transplantation. In around the results of this works, by interrogating literature surrounding pharmacokinetics, pharmacodynamics, and toxicological profile, and data encompassing common immunosuppression therapy or therapies utilized in pediatric nephrology. This has informed that it is still pivotal to recognize the toxicological profile in varying regimens, and especially those that prompt nephrotoxicity effects on pathophysiology and immunobiology. So in around the conclusion, owing to the varying toxicological profile of immunosuppression, and through interrogation of a retrospective literature, this works encourages a formal systematic review to see further that ultimately pediatrics whom receive renal transplants or solid organ transplants can have a better prognosis without implications of nephrotoxic and toxicological profile of pharmacotherapy or pharmacotherapies on renal pathophysiology. some main terminologies in around similar works include immunosuppression, transplantation, pediatric nephrology and laboratory medicine. Yes, and laboratory medicine. That draws this audio podcast to a close. This has been an audio podcast as part of the Proxyl Interlude or Intermission. This has been an audio podcast as part of a Cataclysm Chiasma. This has been an audio podcast as part of a Store Robotics production. Thank you.